The key thing is to understand whether this relationship that's been identified between an increased risk of longer-term mortality and the initial use of either a drug-coated balloon or drug-coated stent that involves paclitaxel. The key thing is to understand whether that relationship is simply an association, which is related perhaps to statistical analysis or possibly randomized trial design, or is it an actual causal relationship? From a standpoint of a pharmacological agent potentially producing increased mortality, there are some that are really germane. And one is called dose relationship or biological gradient. The reason why that's important is because if a small amount of a harmful agent causes a problem, then a large amount of a harmful agent should cause even more problems. And dose relationship is something that we can readily evaluate because we have this information based upon the randomized trial patients and what they actually received in terms of how much paclitaxel was introduced into their bodies in the course of treatment for this peripheral vascular disease. If we have a dangerous agent on our hands, it should be equally dangerous no matter where it's employed. So, and there are a couple of kinds of consistency. It should be consistently dangerous. So one of the things that we have found is that although the signal that was clearly identified in the randomized controlled trial population is definitely there, this signal was not identified so far in any of the real-world data that comes from large data sets around the United States and Germany and other countries that have looked to see what is the risk of mortality after long-term exposure following paclitaxel. And there hasn't been, until now, any identification of a signal. So you have this inconsistency. It's only in the randomized trials. So then if we dig into the randomized trials, we could ask the question, well, geez, what are the various mortality rates for the use of paclitaxel, specifically paclitaxel-coated balloons, in various countries? And what we find is that there is no signal identified in Japan. There's little or no signal identified in the EU, and of course, which is a myriad, multiple countries, but the signal seems to be identified only in the United States, suggesting that there may be some difference in practice, difference in treatment, difference in the population, something that is driving the signal, but it seems to be isolated to the United States. So again, you have this geographic inconsistency. And so there's at least the possibility then that there could be differences in treatment that is supporting this identification of a signal, not everywhere, but just in the United States. The key messages are the following. One is that the use of paclitaxel has led to a dramatic improvement in patency when it has been used, and it seems to be remarkably efficacious, very consistently so, across broad geographies and different devices. The second thing is that there's been dramatic inconsistency in terms of the connection between any potential increase in mortality following the use of drug-coated balloons. And then thirdly, just to reiterate what others have really stressed and presented on, and that is the lack of identification of a dose relationship and the lack of identification of a mechanism. One thing that's just worth noting is that obviously as physicians, we're trying to extend life, we're trying to save limbs. If there is an increase in risk, especially the risk of mortality, which we take extremely seriously, then we have to do the utmost to understand the level of risk and make sure that the patient is fully informed. The flip side is that we don't want to leave our most efficacious tool on the shelf gathering dust if the risk is not significant. So it's super important that we sort through these issues, and that's what we've been doing this past year.